headaches, tongue pain, neck pain, and a chiropractic solution. So a darling 83-year-old woman comes in to see me very recently, new to me, and she says, I have neck pain. It's on one side, it's on her left side, and it's worse at night, it's worse when I'm sitting and watching TV. And I also get headaches on this side too, but she explained, I also get tongue pain on this left side, below my tongue. And so we were thinking for a while that it might have been a dental problem and so forth, so she had a dental workup. She had an MRI of this area, had consultations with oral specialists and so forth. Nobody could find anything. We don't know what's going on. So she ends up coming into my office. Why does she come into my office? Because she saw this television show. She saw me on here and said, I'm going to go see this guy. So she comes in, I do my evaluation. She says, I get headaches here, tongue pain here, and I've got neck pain on this side. Great. So we check out her neck, and sure enough, when I poke here, it's super tender on that left side, and sure enough, she can feel it in her head, right? I work on her the first day. I call her the next day to check on her, and she says, you know what, I'm already feeling better. My neck feels a little bit better. My headache is better. She said, I can't believe it. The pain under my tongue is better as well. I never knew that they were related. We work on her 3 or 4 times. Most of the pain is better. Now, this is over the Thanksgiving time of 2019. So I see her just after Thanksgiving. She says, I'm really doing great. I worked hard for 5 days. I cleaned the house for a couple of days. I cooked for a couple of days, had Thanksgiving, cleaned for another day. She said, usually in the years past, that would have flared me up like crazy, right? I would have had more headaches and neck pain. It didn't happen. I'm actually feeling really good. On a scale of 0 to 10, it was like 1 over 10. She used to be 5, 6, 7 over 10, okay? Great. She goes through that weekend. She comes in the next week, and this is after Thanksgiving now, and she says, I've got a flare-up. My neck pain is worse. The pain under my tongue is worse. The headache up here is worse. So I had to do my investigation, and I said, you did really well when you were super active, right? She said, yeah. I said, what did you do over the weekend? She said, you know, I was sitting more and kind of relaxing. I said, watching TV, right? Right. And I got out of her that she's in a recliner. Shows she's sitting back in a recliner like this. So after we talked about it, I showed her. Here we are back in a recliner like this with the head forward, right? I said, what does that look like? So if I sit up and I stand up, what is this like? Look what it's doing to the head and neck. Heck, we might as well be on a phone texting, but in this case, we were just back in a recliner, still putting strain in the neck, right? So what I had her try at home is experimented with sitting upright, completely straight up and down on the recliner, stuffing pillows behind her upper back to make sure that she wasn't sinking into the chair like a lot of chairs and couches do, right? And a lot of patients have decided these couches and chairs are not working. So she stuffed pillows back here and did that. After the visit, of course, she felt a lot better. And then she did this for a few days and came back and said, it's not happening anymore. I'm not getting uncomfortable when I'm sitting and watching, and when I'm binge watching Health Source, Dr. Fuller, your TV show. I'm not getting that pain any longer. Let's explain why. How can a chiropractor work on this part of the neck and see headache and tongue and jaw pain get better? The answer is in the trigeminal system. It's in the trigeminal system, okay? So, the trigeminal nerve is a nerve that comes off the brain, off the brainstem, and it supplies the head and eye with one branch. It supplies the cheek and sinuses in another branch, and then it supplies the lower part of the jaw in a third branch, okay? The great sensory nerve of the face, this information travels down in a very odd pathway into the upper spinal cord, where it talks to a messenger nerve, which brings the message back up to the brain. So if I touch the side of my face, that information went down, talked to a messenger, back up, and said, I just touched my face. Well, if it was pain, like if I got a pinprick or a burn or something like that, that pain information would drop down, go back up, and say, my cheek hurts. Okay? Well, in this case, she has no damage to the head, or she didn't have any damage here. Now, people can. Of course, you can have a dental problem here that can cause pain there. You could bang your head and have a problem. There are other things that can cause this type of pain. But in this case, this was not her. No pathology here, no pathology here. But why did this have pain? In this upper spinal cord, the messenger shares information from here and the upper neck. They converge. This information converges on the same messenger, and then the message is carried up into the brain. So the brain might see pain information coming from that messenger up here, and the brain says, hey, messenger, where did you come from? Did you come from the head, or did you come from the neck? The messenger says, I'm not sure. I take messages from both. I wasn't looking. The brain said, well, the head's more important to me. I'm going to give you head pain. You literally get a headache, and there's nothing wrong with your head. The problem is pain messages coming from the irritated joints, discs, cartilage, ligaments, tendons, muscles of the neck, sending pain information to the messenger, sending the message up to the brain. The brain thinks it's from the head because the head's more important than the back of the neck. Cervicogenic headache, which is coming from a crosstalk in the trigeminocervical nucleus. Look it up sometime, you don't need to know that. That's just the name of the messenger, just the name of the pools of information coming in. So the message got crossed, irritation to the neck, send it up into the brain. The brain said, you must be coming from the head. Well, the branch here comes in, it received pain information from irritation in the neck, sending it up here, the brain gave her the perception of tongue pain, but the problem was actually in the neck. It's so cool. She is so happy. She's so thrilled that who knew this actually had a neck solution, a chiropractic solution. Remember, she's 83 years old. I'm not doing manual adjustments on her neck. I'm doing light force chiropractic. Drop table, instrument, fingertip pressure. Half a dozen visits later, she's really happy. Not only that, we gave her that strategy at home now. No more reclining in the recliner. We're having sit up straight, pads behind her, and her posture is getting better, better, and better. Imagine what that's going to do for her for the rest of her life. I'm Dr. Scott Fuller.